Welcome, everyone. Thank you so much for joining us today. Please continue to introduce yourself in the chat box, and we'll go ahead and get started since it's 3 o'clock. I'm Sarah Volker, and I serve as the Associate Project Director for HV MIECHV at Education Development Center. We're so glad that you're able to join us today to discuss strategies for identifying at-risk counties as part of the MIECHV Needs Assessment Update. We've heard from many of you about your plans for updating your needs assessment, including work to assemble your team and coordinate with other needs assessment processes that are ongoing in your state. And today's webinar will dive into the methodology for how you will identify communities with concentrations of risk, including premature birth, low birth weight, infant mortality, poverty, crime, domestic violence, high rates of high school dropouts, substance abuse, unemployment, and child maltreatment. This is one step in the needs assessment process, and we refer you to the Supplemental Information Request, or SIR, for the submission of the statewide needs assessment update, as well as the SIR for territories, where you can find additional information and requirements. We have a few reminders for you as you're participating in the webinar today. First, everyone is joining with your phone lines open. This is so that you can ask questions and engage in dialogue with each other. But to help us manage any outside noise, we do ask that you put yourself on mute now and only unmute when you're ready to ask a question. You can also use the chat box to pose questions or comments throughout the presentation, and we'll come back to them when we pause for discussion, or if it's a more complicated question, we may follow up with you after the presentation. You can also use the technical support box that's below the slides if you're experiencing any technical issues. We are recording this webinar for later viewing. Oh, please mute your line if you're able to. And there is a file share box with a copy of the slides from today, as well as a few resource documents that we'll reference later. Joining us today are Rachel Hertzfeld-Kamprus from HRSA's Division of Home Visiting and Early Childhood Services, Cassandra Miller from James Bell Associates, and Carrie Ann Uesugi from the University of Illinois at Chicago. And we have quite a bit to cover today. I'm very excited for everything that our presenters are going to share. So with that, I'm going to turn things over to Cassandra.
Hi, everyone, and thanks again for joining us this afternoon or morning, depending on where you are. I want to run through a couple of quick objectives for today's webinar. I'm going to share a couple of different TA resources from the various TA providers that can support you with the needs assessment. And then we'll jump right into covering the key concepts for the simplified method for identifying at-risk counties for your needs assessment. Carrie Ann from UIC will walk us through a couple of examples, and then we'll dig a little bit into a few considerations for the independent methods. So up first, in our needs assessment resources, we have the peer learning dialogue series, and this is ongoing. We had a session earlier this month on coordinating with other needs assessments, and then we have upcoming sessions, one per month for the next 4 months. The next session in August, we have already sent out an invitation. And if you have not gotten that, we will be sending it out again. Or you're welcome to contact any of your TA providers and they can forward you that invitation. We also have, we just wanted to link here a couple of resources that you all may already have. These are active links, so feel free to grab them here, or we can just, you can find the needs assessment guide in the file share pod. The first is the overall guide with a step-by-step process for completing your needs assessment. The second includes a crosswalk between the MIECHV and the Title V needs assessments to help you align between the two. And I just wanted to let you know of an upcoming resource from Dove on the Step 5. This will be a step-by-step guide to help you conduct the Step 5 to assess your community readiness. We also have various resources to support awardees in engaging tribal organizations in your needs assessment. There is an ongoing tribal community of practice through Dove. You can get the invitation from your Dove liaison, and that is happening beginning later this month and next month. It's not August yet, so apologies. Both the peer learning session and the community of practice will be next month in August. And then just a reminder that the September peer learning series that I mentioned before addresses collaboration with tribes. The remaining invitations for the upcoming peer learning series will be forthcoming. Currently just the August invitations are out. And if you have any further questions or detailed questions, we encourage you to reach out to your HRSA PO and your HV CQI specialist and your TA and your HV Impact TA specialist. Between everyone, we will coordinate to figure out who is best to answer your question and get you the support that you need in order to complete your needs assessment. With that, I am going to turn it over to Rachel from HRSA to give us a few popular Q&As.
Thanks, Cassandra. So since this webinar provides more of a deep dive into identifying at-risk communities, HRSA wanted to take a quick opportunity to just clarify some FAQs that we've been seeing coming in about the simplified method and using data in your needs assessment update. So the first one, as you can see on the slide, is a question around, am I allowed to replace an indicator in the simplified method? The answer is yes, and any added indicators and domains must align with the statutory definition of risk. The second question is, if I add an indicator or domain to the simplified method, do I need to apply the simplified method to the added data? Again, yes, and instructions for adding data or applying the simplified method to your needs assessment data summary can be found in pages 10 through 12 of the SIR guidance. The third question is, if I am adding data to the simplified method or collecting data for the independent method, what years should the data reflect? The SIR indicates on page 13, footnote 15, that data is considered to be recent if it is from 2014 or later. Now, you may use earlier data if you are averaging over a number of years to account for suppressed data, but average data must include 2014 or later data. Finally, if the needs assessment data summary provided by HRSA accurately represents at-risk communities in my state, do I need to add data or modify the simplified method? The answer is no. If the pre-populated needs assessment data summary appropriately identifies needs and at-risk counties in your state, then add at-risk counties to Table 7 of your needs assessment data summary and describe how the counties identified in your list reflect the level of risk in your state in your needs assessment update narrative. Instructions on doing this can be found on page 10 of the SIR. With that, I will turn it over to Carrie Ann to walk us through a little bit more about the simplified method.
Carrie Ann, you may be on mute.
I was, thank you. This is Carrie Ann Ursughi. Can you hear me now? Okay.
Yes.
I am going to go over a lot of similar things that I went over in the All Grantee meeting breakout session. So some of you may have attended. So I just want to put a disclaimer out there that a lot of this is similar slides, similar information. We have made some modifications based on that discussion we had at the breakout session, so that is new. But I just want to forewarn you about that. I also wanted to first mention my colleagues back at the UIC School of Public Health that were fundamental in developing the simplified method, including Dr. Arden Handler and Dr. Deborah Rosenberg. Dr. Rosenberg is joining me today on the phone as well. Our agenda for the next 35 minutes, is to quickly go over some improved example formulas that you can add to your needs assessment data summary Excel file. Secondly, I just want to touch on what information is available in the TA guide for step 3, which is really around identifying at-risk counties. And then the bulk of the discussion today is thinking through reasons to and how to modify the simplified method. And I will be walking through an example of adding sub-county data as well as an example of adding new indicators. Brief discussion on other strategies for the simplified method that you can find in the TA guide. And then lastly, some considerations when choosing an independent method. So I promised you at the All Grantee meeting that there was a better way to do some of these formulas when modifying the simplified method, and we found those better formulas. So they are here. This is a screenshot. We have put the Table 8, this tab, in the file share, so you can download that and insert it directly into your needs assessment data summary as your handy go-to. I'm going to go over these when I go through my examples. Essentially, the enhancement is, instead of creating multiple tabs in order to create ones and zeros and then counting up those ones and zeros, etc., we can do everything now in one logic step. So that's really great. And I'll go through that when I'm going through my example. So just wanted to point out these to everyone. I hope that maybe the TA providers can disseminate this more broadly to all the grantees. But if not, you guys have the first look at it here. So for the TA Needs Assessment Guide that has been out since February, Step 3 really goes over the simplified method, what its advantages are versus the limitations or considerations you may have. It provides some detailed instructions for adding sub-county data and adding new indicators. What I'm going to go over today is a slight modification of instructions for the sub-county data, so keep that in mind. Highlights for other strategies in terms of other ways you may want to simplify the simplified method. It also has suggestions for your work plan for how to fit in these types of steps that you might want to be taking in terms of modifying the simplified method. And it does have guidance around choosing an independent method. So the whole reason to modify the simplified method is mostly to add more data to the data that we provided you. And a basic question to ask ourselves is why do we need to add data? When you're thinking about adding sub-county levels, I'll get into this a bit more in depth, or adding new indicators, a fundamental reason is to enhance sensitivity, which means to be able to capture more communities that are at risk than maybe the initial needs assessment data summary is able to capture. Additionally, for new indicators, it might be important to add data if you have it available, if you feel that this other data may better reflect the statutorily defined criteria of risk versus the indicators that were chosen for the simplified method. So just like the FAQs that Rachel shared a few minutes ago, we've been seeing a lot of these questions coming in from states specifically about, they're asking us, can they modify the simplified method in this way or that way? And we've gone through a lot of states, and our answers back to the states, typically states and territories, are typically the same. We always pose this first question of, if someone is thinking about adding new indicators, the first question that we sort of go back with is, why are you considering adding this indicator? And it comes down to, we assume that most people would have the hypothesis that the simplified method is not picking up all the counties that we believe are at risk. Adding these indicators will identify more counties, or maybe you have specific counties in mind. Again, this goes back to that sensitivity issue. wanting to pick up more counties that are at risk by adding data. So a second question that you can ask yourself without doing any spreadsheet work, without gathering any new data, is if you add this indicator or indicators, will a county which previously did not meet the threshold reach the threshold if it has a high or greater than or equal to 1 Z-score standardized value? So this is no spreadsheet work is needed. For many of the questions that we've been getting, we haven't done anything with actual data. We've just thought through, okay, if they add 1 indicator to a domain that already has 2 indicators in it, well, adding that 1 indicator, even if that county has a high standardized value for that indicator, will that make a difference in reaching that threshold, which is having more than 50% of the indicators in that domain being greater than or equal to 1. So it's just sort of a thought exercise. And if it's adding 1 indicator is not going to do anything because of the change in denominator, then maybe you want to think, is this really helpful? Is it going to identify anything? Are there more indicators that we need to add, et cetera? In terms of thinking through adding sub-county data, again, a first question to ask yourself is, what is your hypothesis? Why are you considering adding sub-county data? And from what we reasoned and what our thinking was when we were developing the simplified method, the hypothesis might be within a county that was not identified as at risk in the simplified method, there are sub-county areas that may be at risk compared to other counties in the state, which may mean that if there are areas of risk within a county, that whole county could be considered at risk according to what guidance we put into the SIR. So if we add sub-county data, will it help to identify counties where that risk is masked probably in a large heterogeneous population, et cetera? And I'll talk a little bit more about that as we go through the example. So the second question that you might want to ask yourself is, if you add that sub-county data, are you adding data that reflect the risk factors that you believe are relevant? Will it help you identify those sub-county areas? Will it help them reach the threshold? Again, it's a thought exercise. If you think that the areas of risk are pertaining to poor indicators of SES, like poverty and unemployment, will adding those 2 indicators help push certain sub-county areas over the threshold for having 2 or more domains at risk? So again, once you're into the spreadsheet and thinking through things, I think you'll be able to do a lot of this work without manipulating numbers and things like that within the spreadsheet. So just to give, just to highlight a lot of the questions that we've been answering, just as Rachel did, here are some questions that we've received and been able to provide answers back to. One question was whether or not you could add indicators that are based on data with very small numbers, for example, maternal mortality at the county level. And again, the issue with small numbers is sometimes those numbers are very unstable across the years. So one suggestion is to use multiple years of data to improve stability. A second consideration is, maybe you don't have a lot of years to average across, to aggregate across, but maybe you want to think about, are you seeing a trend in those counties that you want to incorporate in the phase 2, and then you can consider how you want to add that data. Do you want to add trend data in phase 2 as a sole criteria for that county to be at risk, or do you want to somehow revise the threshold for the simplified method, where adding, or you might see a worsening trend in the county, plus they have one other domain that's at risk in the simplified method, and those 2 combined, you want to say that makes a county then therefore at risk. There are things you can do to think through how you would want to add that kind of data. Another question was, can we add an existing indicator that's in one domain to other domains? So, for example, adding unemployment, which is an SES, to the crime domain because maybe unemployment is related to crime. When thinking through that to help with the state, you know, to us it didn't make sense because adding it to another domain is not weighting that particular indicator, making it worth more. We felt that it might be more valuable that if you do want to weight a particular indicator, you want unemployment to be stronger than other indicators, you probably should just do that within the original domain where you can say if it's got a high Z-score for this one particular indicator, we're going to count that 2 times or something like that within the original domain. So that was our general answer for that one. Another answer that Rachel actually just answered was, can we replace an indicator from the SEM? And we, of course, that is fine if you have a state source that you feel is better. But again, it must reflect the statutorily, the criteria in statute for areas of risk. So now we're going to just walk through examples of adding sub-county data. So I did modify this example from the one that I provided at the all-grantee meeting. I previously used census tracts, which became quickly unyieldy for, for example purposes. So here I added sub-county areas from County 16 in State A. This is the most populous county in the state. The sub-county areas were basically all the different cities and townships. So you have a main city and then the suburbs that also exist within that county. I added poverty rates and unemployment from the American Community Survey. And just to note here, and I'll explain this again, the change from the TA guide, instead of recalculating the mean of counties and standard deviation using all the sub-county areas as well, and in replacement of the original county, here we're calculating Z-scores using the original mean of counties and standard deviation, and I'll explain that a little bit further in a minute. So now we're going to go to Excel. Sarah and Cassandra, am I able to, there we go, share my screen.
April just opened up SharePod. Did you find it?
Okay. That doesn't look like I'm able to share my screen. Oh, I see options. Oh, let me just try. Can you see my screen now? Yes.
Yeah.
Yes, you can. Okay. So here is a data needs assessment data summary for State A. You've all seen this for your own state. What I did was I went to the tab 4, raw indicators, and I have counties 1 through 102, and then I added the raw values for poverty and, as you can see, unemployment for these sub-county areas in County 16. So I have 31 sub-county areas. These were the poverty rates and unemployment rates for the same year as the data for the rest of the counties. So on the standardized indicators page, I don't have to do anything with the original counties. The only thing that I have to manipulate is on the sub-county area. I want to put in this formula, which is equals the word standardized, and then in parentheses, the first segment is the value that you want to standardize. And so that's from the raw indicators page, cell B104. So that corresponds to here, raw indicators, cell B104. And then, why does it always change? Sorry, guys. Okay, so, and then the second thing that you put into the formula is the mean, the original mean, and that you can find that from the descriptive statistics page under the mean of counties. So for poverty, it was 13.3, and the last thing you would put would be the standardized deviation for the original mean, standard deviation for the counties, which is 4.4. So I'm going to put that in. And that gives me a Z-score of minus 1.9. So I copied that formula for everything and for all the sub-county areas, and then it automatically highlights, because of the formatting, any of those sub-county areas that have a Z-score greater than or equal to 1. I did essentially the same thing for the unemployment indicator. I used the raw value from tab 4 and the original mean and the original standardized deviation of 0.9. And so those are my standardized indicators. And then on the 6th tab, at-risk domains, again, I don't have to do anything to the original, like the main counties. I go down to the sub-county area where I've added sub-county area 1 through 31. I've added the population just to make me aware of that, just as I had done for the counties. And then for the SES domain, because that's where we added the new indicators for the sub-county areas, I use this new formula, which is count if, and then parentheses, the cell from the standardized indicator page, the range of cells, so the count if B104 to E104 on the standardized indicator page. For those which are greater than or equal to 1, then divide by 4. So it's summing up all the Z-scores that are greater than or equal to 4, taking that sum, and then dividing it by 4, which is the number of indicators that we have. So this will give you the proportion of indicators in that domain which have a Z-score greater than or equal to 1. And again, it automatically highlights all of those sub-county areas that have this proportion greater than or equal to 5. And then because nothing else changes, well, let me go back one step. For the standardized indicators for all the other indicators that we didn't have sub-county data for, I just copied the data that was available for County 16. So it's all the same data for every other indicator. So here, again, it's the same proportion as what County 16 had. So before, County 16 only had 1 out of 4 indicators on SES having a Z-score greater than or equal to 1, so it did not meet the threshold for at-risk in that domain. The only domain that County 16 met the threshold for was crime. So in the original needs assessment data summary, County 16 was not considered at risk because it only had 1 domain that was at risk. When you add sub-county data, now we have several sub-county areas meeting the threshold for SES to be at risk. And so adding that plus the crime domain then highlights several sub-county areas that might be at risk within County 16. And then according to the guidance, if any of these sub-county areas met the threshold for being at risk, then County 16 could be included as being at risk, is sort of how it was written in the SIR. And that is the general approach for adding sub-county data that we've worked out. Table 7 doesn't change. Here, instead of the original counties that had 2 or more domains at risk, you could now include County 16 because you've added the sub-county data, et cetera. So I'm going to go back to, if I can go back to the presentation now. Okay. Thank you. How's my time? Oh, we're doing very good. Excellent. So to summarize, you saw that I added sub-county data for only 2 indicators because, you know, honestly, that might be all you have available. You certainly could add sub-county data for all the indicators if you had that. As you saw, what I did, and we've actually done for territories, is use that county-level data or territory-level data for indicators where you don't have sub-county data or sub-territory data. So you're sort of combining, you know, the information you do have at the sub-county level with the information that's already available at the county level. So again, I just wanted to reiterate that before you even add the sub-county data, you can do some of that thinking through of whether you add X indicators at the sub-county level, will that actually improve the sensitivity? Do you actually feel that you'd be able to pick up areas within that county that are at risk and would then help to highlight or identify that whole county as being at risk? And so you saw that we were essentially comparing the sub-county data to all the other counties in the state. And this was something that we discussed at length at the all-grantee meeting. We discussed whether it was appropriate to assess the sub-county data using the mean and standard deviation of other counties in the state, or whether the sub-county data should be assessed using the mean and standard deviation of the sub-counties with values within their particular county. We still think it's most appropriate to compare sub-county values to the other counties in the state because whether using county level or sub-county level data, the goal is to identify at-risk counties. County is the geographic level of interest. Using sub-county data is just a way to overcome the problem of a county not being identified as at risk because it has geographically uneven and heterogeneous risk. So however, after thinking through this, we suggest that the best way is to calculate z-scores for sub-county data using the mean and standard deviation that would have been calculated if county level data were being used for that indicator. The goal here is to locate the sub-county data on the distribution of counties within the state. So here it is, you know, where does that sub-county data fit or appear to fit when you're looking at the distribution of that indicator across all counties in the state. To be clear, to us, the simplified method is mostly a form of ranking. It identifies the relative position of areas, geographic areas on a distribution. It's not a statistical test. So in the end, what we're really trying to do is rank these across the distribution and then summarize these relative positions or ranks on these indicators within and across domains to identify at-risk counties. So that is the way you can think through what the simplified method is fundamentally doing. And so that's why this is the approach that we think would make the most sense. It doesn't affect the other counties and whether or not they would be considered at risk because you're not recalculating the mean and standard deviation. So it's not weighting things towards the sub-county, the county with the sub-county areas, et cetera. So this is what we thought through. If you have any more questions about that, please send them to me and we can think through it some more. Other sub-county units to consider: census tracts, zip codes, neighborhoods, cities and suburbs. You know, you guys know best what's available in your state or territory, and we can also help you think through things that might be appropriate. So now we can move on to adding new indicators, an example of that. Here, this is the exact same example I provided at the all-grantee meeting. We added 2 county-level indicators related to the substance use disorder domain. I added alcohol and drug-related hospitalizations from the HPUP project, which is hospital discharge data, as well as drug-induced deaths that was available from the CDC Wonder site. So if I could share my screen again. All right, we have another state. Here I will start with the 2 the first thing I modified was I added these two indicators within the substance use disorder domain, hospitalizations. I defined it for myself so I could keep track of that, drug-induced deaths, definition, the years that I used, the source that I used, etc. Which is all just helpful documentation. I also added
Carrie
two
Ann,
rows.
sorry to interrupt. Can you select the share your screen option again? We're not seeing your screen just yet.
Sorry.
There we go. That looks like it's
There we go.
screen.
Okay.
Perfect.
So back
Thank
to
you.
this. I added rows on the description of indicators where I, defined my new indicators, the years, the source, etc., just for documentation. On the descriptive statistics tab, here's the definition again, the years, and I provided all the descriptive statistics that we provided before. So for the raw indicators page, I simply inserted two columns and added the values that I had. You can see that there's still some missing data, specifically with drug-induced deaths. You may have access to the full unsuppressed data set. That's great. This came from CDC Wonders, so there's a lot of suppression. So these are the raw indicators. The first step was to standardize the raw indicators, and here I used the value from the raw indicators page, and then comma the mean, which is just a fancy way to say grab it from this particular cell, and then the standard deviation, grab it from this particular cell, and then copy that formula into all of these to calculate the standardized values. Again, the formatting automatically highlights the counties where the z-score is greater than or equal to 1. And then I did a couple different things with, adding these new indicators. I think we went over this last time as well. I kept in the original domain, which was calculated on the substance use prevalence data, which was 4 indicators. Then I added in the same, then I copied the domains and then added in a new substance use disorder domain that incorporated the additional 2 indicators. So the indicator went from 4, as you can see here on the formula, to 6. And then lastly, I was just playing around to see whether or not it's helpful to create a completely new domain instead of incorporating those 2 indicators into a domain. And then here I have a side-by-side of those 3 different scenarios. So this is just one way that you can utilize your spreadsheet to help you ascertain whether or not it's useful to add new indicators. Is it better to enhance sensitivity, or are you picking up something different if you're adding it to a separate domain, etc. So you can see this is the original answers that you would have gotten in your needs assessment data summary. When you add those 2 additional indicators to your domain, so you now have 6 indicators in the domain, it doesn't actually change which counties are identified as at risk. So it did not really enhance sensitivity. So this is something you may figure out before you even add any data as well. So here is, in this third scenario, this is where I added a whole new domain called SUD outcomes. And you can see that, again, it's still picking up the same states, or same counties, I'm sorry, as before. It does pick up a few new counties. And as you can see, the 2 domains that it's reaching the threshold on are the substance use disorder original domain and the substance use disorder outcomes domain. So again, you're just finding counties that have a bigger areas of risk around substance use disorder. So that was the same scenario for this county, this county, this county, this county. this county. I think it's nice with the way these things are formatted is you can easily test how you would add things out and to see whether it would change something, whether or not it would pick up additional states. So I just wanted to show you that this is an opportunity for you to utilize your spreadsheet to help you make decisions about what data you do want to add to it. So that's everything I have for this example. I will go back to the slides. Can you go back to the slides? I'm not seeing, I'm seeing like a blank screen on my Adobe Connect now.
I see the slides. Can I advance them for you?
Sure.
I'm not sure if you'll be able to do it going in blind.
Okay. Sure.
Here, let me see if I switch the slides. Did that help? We're on a summary slide.
It says leave the meeting. I can just do the summary slide. So there's the other ideas for indicators. You could add additional indicators of risk for the maternal child health population. You could add additional SES indicators such as public assistance. If you actually have indicators for domestic violence or such as program data, you could add that domain because that's something we didn't have available from a national data source. But again, like I say, please think through whether or not adding X number of indicators would actually enhance your sensitivity. Will you need to modify the threshold for the proportion of indicators to be at risk? Do you need to create a new domain like we talked about in the example, et cetera? So in the TA guide, I don't have a lot of time. I just want to point you to that there are some other strategies. We talked about changing thresholds. Maybe you don't want to just use greater than or equal to 1 Z-score. Maybe you want to lower that threshold a little bit in order to enhance the sensitivity. For states that have a lot of missing data, you want to see whether or not those states that have missing data, do they look similar to other counties for other domains that you may be able to make some judgments on. A lot of that's thought through in the TA guide. And then lastly, in the last couple of minutes, just wanting to discuss independent methods, what would be an independent method, and considerations for it. So, you know, in terms of an independent method, most likely you would have access to alternate data and data sources. Might be one reason why you choose to do an independent method. And also you would be selecting an alternate rigorous quantitative approach. The examples that were provided in the SIR included like a composite index method, which is actually kind of similar to the simplified method in and of itself. This method combines multiple indicators into one composite measure. Usually you have a raw indicator value, you standardize it in some way, and then combine it into domains to create with related indicators and create domain scores, which are combined either averaged or scored, et cetera, in order to define cut points at which the indicator values are combined. Another method that we put in the SAR, which again is not completely different from a simplified method because it could just be weighting indicators within domains like we talked before, or weighting a whole domains because you feel that they're more important than others. Correlation methods where you are using a correlation metrics of all the indicators to see which indicators are more or less correlated with one another. Some examples include factor analysis and principal component analysis. Essentially, these are helpful to identify groups of similar variables based on correlations and variation in the data. And these methods can help assist you in developing new domains for a composite score. And then lastly, a heat map is just a graphical representation of data values. It can be used with the above methods or even the simplified method as well. You know, you might want to be shading different counties and sub-county areas according to risk values, number of at-risk domains, et cetera. You know, there are many other multivariable methods and combinations of methods that could be used with or without formal statistical testing to identify at-risk communities. The assumptions of any approach should always be explicitly stated and thoroughly written out so that HRSA can understand the process that you went through. Some considerations on the last slide of why you might consider doing an independent method. Maybe you already completed a needs assessment after October 1, 2016. Maybe your state or territory has preferred methods of assessing geographic need. Maybe you have sufficient analytic capacity and access to data in order to conduct an independent analysis or an independent method. One consideration of that is, if you do have that additional capacity and access to data, that's probably something else that's needed for modifying the simplified method. So you should think through whether or not having that capacity and data access precludes you from using the simplified method. Like maybe it's just a sophisticated modification that you want to do. And that would also help enable, comparability of states reporting to state and federal stakeholders. And also, lastly, just to point out that there's the opportunity in Phase 2 to add counties that you know to be at risk. So choosing an independent method may not be cost effective if additional time and resources are needed beyond those associated with choosing the simplified method. So that's what I have for today. I can turn it back over to Sarah and Cassandra.
Great. Thank you so much, Carrie Ann. If you have a question, please feel free to type it into the chat box, or you can use the little person icon at the top of your screen to raise your hand. We have had a few questions come in. So first we had a question about finding past webinars for watching. I included a link in the chat box. You can find that. And so that is where all of the recorded webinars around the needs assessment or other TA topics are saved. That is where this session will eventually be saved. I do know that the peer dialogue sessions are around the needs assessment are not being recorded just because of the nature of those sessions. There's breakout rooms. It's a little more complicated, but notes from those sessions will be circulated. And then we had another question come in, and Carrie Ann, I think this is for you. So it says, what is the reason behind choosing one standard deviation z-score as the cutoff? Can we use 2 standard deviations instead? Or would that be phase 2?
Oh, great question. No, I don't think that's necessarily phase 2. I'll read you, this question was already asked a couple weeks ago, and I'll just read you exactly what we provided that state. The choice to use of one standard deviation was based on finding a balance between sensitivity and specificity in identifying at-risk counties. A z-score of greater than or greater or less than 1 on an indicator means that the county was in the worst 16% of counties in the state. If you use a standard deviation of 2, a county with an indicator value greater or less than that threshold would be among the worst 2.2% of all counties in the state. So we think this definition of at-risk is a little too narrow. That's the main reason why we didn't go to something like 2 standard deviation or too specific. It results in a very small at-risk pool, likely excluding counties in need. Conversely, if you think about lowering the threshold, which I said was one strategy, you don't want to go too far in that direction because you might make it too broad. The definition of at-risk might be too broad or too sensitive, resulting in more than or close to 1/3 of all counties being included at the at-risk. Well, if you use a 0.5 threshold, likely losing the ability to discern the counties most in need. So there is room to modify and move up or down a little bit, but you just want to be mindful of what that means by moving all the way up to 2 standard deviations or going down to something as low as 0.5.
Great, thank you. there are other questions at this time, please type them in or take yourself off mute. You can ask it over the phone. I will remind you that you can always follow up after this session. If you have specific questions, reach out to your TA specialist, and they'd be happy to help you with those questions, and we'll pass them on to Carrie-Ann if we need her assistance with them as well. All right, I think I'm going to move us forward, and Cassandra has a few closing things for us.
Awesome, thank you. And we have a quick poll for you all that has 3 questions. It's popping up on your screen right now. So we'd love to know if you all plan to take an action step based on this webinar. And if you said yes, to tell us why. And if you said no, also we'd be happy to hear why. There are no wrong answers, so we're just very curious to learn about how we can make the TA as specific as possible and as helpful as possible. We'll give you all a second to answer those. Okay, great. We'll just give you a second for a couple more responses, and also cheers to the person who wrote in that they're already done with your data and you've created your heat map. So congratulations on that major step complete. Okay, April, I think we can close out the poll now, and we will move on. There is one more thing that we would ask your help for. We have a satisfaction survey. You can click the link on the screen. There is a link in the chat box below, and then we also will have a link as soon as you close out of this, so lots of opportunities to provide some feedback. It's really short, just 5 minutes, and again, this is really helpful to us as we're planning future TA. So I thank you all for joining today and remind you that there are a few relevant files to share in the pod below that you can download. We also encourage you to reach out to your PO and TA specialist if you have any specific questions, and we thank you again for participating.